Okay, up next we have Last Minute, and on deck is Mongoose.
All right. All right. So, hey, everyone. My name is Leo Dasa. I am the CEO and co-founder of LastMinute. We enable healthcare providers to fill shifts quickly and efficiently while reducing operational costs. So this was all evident when in 2016, I shipped up to Boston to care for my brother who was diagnosed terminally with cancer. I started going with him to chemo every weekend. And what I noticed was whenever the nurses were understaffed, he was lacking care. Alarms ring unanswered, delayed care, missed meds. And what we realized was it wasn't because people didn't care. It was really simply because the system was falling under the weight of understaffing. So that's when Leslie, last minute CNO and an active nurse, pulled me aside. She saw I was trying to figure out what was going on and gave me a glimpse behind the scenes. It turns out that the chaos was beyond just the unit. Leslie was getting slammed. Text messages, desperate phone calls all day long, from nurses trying to swap shifts with her, from managers begging her to cover last-minute call-outs. The entire staffing system was on life support with Google's spreadsheets, desperate phone calls, and text messages. So we decided, let's use AI to actually automate this process. Let's make it so that managers can easily get that last-minute coverage that's needed, and nurses can easily swap shifts whenever they need to and be able to have predictive insight into who's actually going to swap shifts with them. So from the manager's end, you have a mobile app in your hand and you're thinking, okay, how can I go ahead and get somebody to cover my last minute call out? Because people are calling out a lot. That's the unfortunate circumstance. And it's always understaffed. All health systems are, for the most part. So in the app, what's going on is you're able to say, okay, I need to get last minute coverage. I'm going to click one button to be able to go ahead and streamline that so I can get the quickest person, the easiest person, the closest person to come in. From the nurse's end, what happens is with one click of a button, they can call out, or you can disable that. But more importantly, you can go in and you can say, hey, I need to swap with somebody. Instead of calling out, instead of using PTO, instead of doing all of these things, working 3 days in a row, 4 days in a row, increasing burnout, I can go ahead and get somebody to swap shifts with me rather than texting somebody, calling somebody, begging them while you're doing something in another state. So from a market, insight, it is essentially $1.5 trillion, just in terms of U.S. workforce. We need to earn our right to work to expand from there. So what we're starting with is managing staffing operations in outpatient clinics. So the reason that we decided let's work on this now is because AI is so leverageable right now that you can use it to be able to not just get predictive insights, but to be able to get that insight into operational efficiency for the staffing and for the administrators. This isn't just a solution of let's just get last minute coverage, let's just swap shifts. It's what's going on in the outpatient clinics, who's on PTO, where's their premium pay, where's their overtime, how can we reduce all of this? Because hospitals right now are spending hundreds of millions of dollars, health systems, on this. And then when you think about the competitors, there's a lot of great solutions out there. I think where we differentiate is, first of all, our insight into working with outpatient clinics, being able to understand how do we actually automate this, not just for all of healthcare. When you look at these solutions, they're great for all of healthcare, for different hospitals. When we talk to CNOs, we talk to CEOs, whoever it might be, they're essentially using one solution, one size fits all. We're really focused on outpatient clinics. Here's kind of our ROI, $1,500 a month per site. And then this is kind of how we're seeing things from pilot to getting to $100 million in ARR. We have a pilot with Northwestern Medicine right now. Happy to answer any questions.
Judges, the mic is yours.
Hi, I'd love to learn more about the pilot. How long has it been? What have you
Thank
feedback?
you. Great question. Thank you. I'd like to learn more as well. I'm just kidding. So we kicked off the pilot in February. It's a 6-month pilot. It ends in August. We've rolled it out to 8 clinics of their 120 total outpatient clinics in their western region suburbs of Chicago. And so far, what we're learning is that there's a lot of administrative burden with using Excel sheets and Google Docs to move staff around. And so what we're able to see is that just within the solution, within the web app, we're saving them a lot of time because we've built in the Excel view while still being able to change everything that they need to in the schedule in the solution. So we're seeing that we're able to save them hours of time.
So what is the actual feedback from the users? What are they saying to you right now in this pilot?
During the pilot, what they're saying is that things are going well. I think with health systems, what I'm also learning is no one's ever going to jump up and down and say yippee, but they're still piloting with us. They could have cut that off, yesterday. So I think things are going well, and I think that we're getting a lot of ROI insight into their administrative overhead, their staffing operations, and also how much time they're spending, again, with the manual burden.
And on your SWOT, obviously the biggest threat is the incumbents, and they're not going to just let you come along and play in their park. So what are you going to do to keep yourself ahead of them? So this
is actually, I love this question, because I think this was actually more relevant a couple years ago. But with AI, I think a lot of people can go create software in a week and days, whatever it might be. I think where we stand out are two things: both the data that we're collecting, how we're collecting that with pilots, how we're going to leverage that and working closely with these pilots to understand that. And I think also my background, coming from 10 plus years in sales, being the top sales rep at every company I worked at, right now more than ever, I think that's where you stand out. Because you can try to use AI for sales, whatever it might be, but it's just apparent even in our pipeline that the sales is something that's paying off versus these other companies.
Is there any secondary income beyond the obvious use of the platform? Can you see anything there?
Say that again, I'm sorry?
Secondary income.
Secondary income?
Yeah. You've got the direct sale of the platform, but you're going to get something from it. So how are you going to leverage that data you're acquiring to help?
I haven't thought about selling the data. I've more so thought about using the data for AI to give people predictive insights and to say you call out 4 out of 5 times. We can let you know that there's an 80% chance that you're going to actually be properly staffed, or you might want to go ahead and get somebody else, and so forth. We also have the AI, which is named after my brother. It's called Super Yoni, which essentially, gives you insight into the different things that you need. So you